Good morning. My name is Michael Stefan. I'm from the EIT Innovation Center, and I would like to welcome you on the morning health talk today. I hope that this is a very sunny morning in anywhere you are from Europe, and let me warmly welcome you to today's event, which is going to be focused on people-oriented digitization of healthcare. We'll primarily look at lessons learned from the USA and Portugal, but we also have a guest speech that will follow up from Joanna regarding the patient privacy and health data. I'm very glad that we have a nice portfolio of three great speakers for today, because the first one is a person that is working with and for the industry, having a lot of experience with Linet and direct people. The second person that we have today as a speaker is actually a person from a hospital, a doctor itself, who has a well-recognized experience from Portugal, Sofia Couto da Rocha, and this will provide us very great benefits and contributions from Portugal, but also from her digital transformation experience. And I'm also very happy that the last of the portfolio speakers for today is Joanna Stupario from HealCloud, who will bring here extensive experience from patient privacy and health data digitalization and workflow. So I'm very happy that we have such a great portfolio of speakers for this morning health talk today, which will bring us a lot of great inputs for the discussion that will follow up later on. Looking at the agenda today, there will be a short introduction at the very beginning, and then we will go straight to all three guest speakers, looking at the digitization of healthcare and the patient privacy. If you have any questions for the speakers, please keep them for the moderated Q&A session that will come at 11 o'clock for all the three speakers together. And then in the last half an hour, we also have with us today three important stakeholders, Martin Zeman from Ministry of Health, Hanna Chlebná from Czech Invest, and Tamás Babel from EIT Health, who will be able to tell you a little bit about their activities, and also you'll be able to ask them and network with them for any kind of questions. So please still stay with us. There is a lot of people who registered for this event. You might be able to see the names now on the screen. Some of them will hopefully still join. And there is a couple of rules for today. First of all, we'll be very happy if you can name yourself correctly in the participant list, so we could attach you to the right institution. We'll be very happy if you can switch on your camera so we could able to see you. The best experience you will have from this event if you choose a speaker view, so you'll be able to see the share screen with the person that is actually talking. Also, if you are not speaking yourself, please mute yourself so you are not interrupting the others. If you have any questions during the Q&A, please, there is a functionality on the Zoom call which allows you to raise a hand once you hit the reactions menu. And we as moderators of this event, specifically myself today, will definitely give you a word, and your questions will be answered. And of course, if you are joining this event, but you are not going to listen in English, because English is going to be the core language of today's event, we have two great simultaneous translators who are available for you on the interpretation channel. So if you go to the Zoom settings on your browser, on your window, you can click on the interpretation and select Czech Česky, and you will be able to hear everything what we say in Czech. And with this, I reminded myself that I would kindly ask all speakers not to be super fast speakers for the simultaneous translations, so we can handle that. In the same time, try to be standard in terms of pace of your presentation, please. And with this in mind, I would like to welcome also again all the participants that were just let in from the waiting room of this event. Welcome again to the morning health talk, which is based on the topic of people-oriented digitization of healthcare. So for the first, let me do the short introduction of the main organizers of this event. First of all, I would like to introduce you EIT Health itself. So before going to the first speakers and their presentations, let me tell you a few details about EIT Health itself. Let's start with EIT Health. This is a European Institute of Innovation and Technology for the healthcare segment. EIT Health works to overcome fragmentation of the healthcare system, address broad challenges, increase efficiency, and break down barriers. And how? This is by bringing together research, education, and business. It aims to help healthcare grow and evolve. They want to contribute to a stronger health ecosystem in Europe and also to promote healthy living and active aging. And they can also help create new jobs and businesses through contributing to a sustainable health economy in Europe. At EIT Health, we facilitate innovation to improve the health of European citizens. We foster collaboration and support innovators with funding, expertise, and access to the market so that breakthrough ideas can be implemented rapidly. We collaborate across European borders and bring stakeholders to the table. We also build strong links between business, research, and education. And we connect innovators with payers, public authorities, and investors. How do we do it in EIT Health? By leveraging the full potential of being one of the largest healthcare initiatives worldwide. In numbers, this means that EIT Health has more than 130 leading member organizations from all important healthcare areas, namely industry, public research, and higher education. We also have a strong partnership all along the knowledge triangle among the academia, industry, research centers, testing labs, incubators, and accelerators. Now let's have a look at two most relevant pillars of activities shareable today. The EIT Health acceleration opportunities catalyze new business growth to deliver transformative products and services. For example, the Incubate activity line offers support for not yet entrepreneurs or scientists wanting to develop startups. Activities include, for example, innovation training, assistance with initiatives like Launch Lab or other bootcamp programs that help entrepreneurs create a business plan out of an initial idea or research project. The Validate line, for example, places emphasis on validating products and services, and our network of living labs and test beds provide entrepreneurs the means to test products through the value chain. The Scale activities focus on more major startups and SMEs to facilitate access to tools and networks for financing and market expansion. Through innovation projects, EIT Health supports innovators in the stages between research and market entry, so they can attract private investments. For each innovation project, there is built a task force of world-class experts from the worlds of business, research, and education to develop the most promising solutions into real-world commercial viable products or services. And up to now, there are more than 100 innovation projects that have been supported already, including some projects from the Czech Republic. Now, these are the 6 areas that were chosen for the 2020 call for innovation projects, just to give you an example. And if you have any more questions related to the EIT Health itself, we'll be more than happy if you contact one of us inside of DEX Innovation Center, who is the hub of the EIT Health in the Czech Republic. So this was shortly about the EIT Health itself. And let me also tell you shortly about 2 other organizers of this event today. The first one is DEX Innovation Center, who is actually the EIT Health Hub in the Czech Republic. So in DEX Innovation Center, we actually have a very simple mission. The simple mission is to improve societies through digital innovation and research. And we do it primarily in three main segments. One of them is smart health, the other one is smart energy, and the last one is smart transportation. We focus on four main pillars of our activities in DEX Innovation Center. One of them is raising the funds for innovation. Second is co-creating new products and services. The third one is building new technological teams and startups. And the last one is education. Now, when it comes to fundraising, in the last 9 years, we were able to raise 28 million euro for 14 large-scale projects. When it comes to co-creation, we are usually involved in all different stages of the co-creation process, starting from the user-centered design, user acceptance testings, up to the pilot capitalization and exploitation part of the co-creation process. In terms of working with startups or technological teams, we currently have 83 alumni startups in the portfolio who raised more than 6 million euro investments, including the startups from the healthcare segment, such as Inocure and Tesla Medical or Sempia from abroad. We do multiple activities and events for the startups and technological teams through awareness, identification, acceleration, and incubation. Just to name a few, would be Startup Europe Week, Innovation Days under EIT Health brand, boot camps, and also CE Connector Angel Co-Investment Fund initiative, together with a specific digital health related acceleration program that is called For Digital Health. In the last pillar that we focus on in DEX Innovation Center, which is education, we try to work with multiple target groups, whether they are youngsters or older people, more than 50 years old. And we work with the phrase generation ready, which means that we want to educate the people around us not to see problems as threats, but rather as business opportunities. As I said, we are the only EIT Health Hub in the Czech Republic, representing all innovations in healthcare, but we are also in the same time a hub for the EIT Energy in the Czech Republic. Here, I would just like to highlight a couple of open initiatives from our side currently. Also, as last year, we are currently opening up an acceleration program for startups in digital health, not only from Czech Republic, but also from other 13 states. If there is any startup interested, there is an application procedure being opened till the end of August, so feel free to go and apply. The second big activity which I would like to highlight here is a Hello AI Risk program, which is organized in cooperation of EIT Health and GE Healthcare. And in a role of EIT Health Hub, we are representing and bringing Czech students and Czech practitioners of AI into this program. Last year, we were able to bring more than 30 people. This year, it is already more than 40 people. So I'm very happy for such an interest from the Czech market. The last event which I would like to highlight is, and this is especially relevant if you might want to invest in early stage startups, is one of the events we are doing as part of the CE Connector Angel Co-Investment Fund initiative. Together with one well-experienced business angel, Petr Skala, we are organizing a webinar on June 29th. So if you want to join us, we'll be more than happy. And of course, this is not the only event today that we are doing as part of the EIT Health Morning Health Talk. We are continuing based on today's discussion next Wednesday. We will look at good case studies from all over Europe that will be presented by Tomáš Vavrečka from Philips and Teun Šuté from Mobility Europe. And the whole topic will be then concluded by a moderated discussion that will be led by Adi Kaskal from the UK and from Forbes. So you are more than welcome to join us for next Wednesday as well. With this in mind, I would like to tell you a little bit details about a co-organizer of this event, with whom we have put the concept for this event together. It is a direct people organization. Direct People is the first innovation agency on the Czech market, and their mission is to improve lives of people through innovation. And for the last 11 years in the business, they worked for and with more than 150 companies and institutions and brought to the market over 40 products. Currently, they operate mainly in Central Europe, but have products worldwide. And with this in mind, I would like to put your attention back to the main topic of today, which is the EIT Health Morning Health Talk. Those events are regional forum discussions and networking platforms with the aim of co-shaping and improving the healthcare innovation ecosystems. And the regional key opinion leaders, policymakers, authorities, startup investors, healthcare professionals bring to the regional table some of the most urgent healthcare challenges faced in European ecosystems. And the topic for today is digitization of healthcare. So this can be carried out through different approaches, whether there is a top-down centralized approach or a bottom-up initiative that potentially goes slower based on the needs of patients, doctors, and other healthcare stakeholders. So which one is better, and what learnings can we take from other countries like USA and Portugal, and what implications this might have for patient privacy and health data? This will be the topic for today, and with this I would like to give a word to the first speaker of today, who is Josef Dvořák from Direct People. So Josef will come today, and I will shortly give you a chance to share your screen and present your inputs for today. Thank you.
Thank you, Michal. Can you hear me, first of all?
Yes, we can.
Okay, perfect. So hello, everybody. Thank you very much for having me. I hope that everybody has a great morning. So let's jump right into it. I will probably make this smaller. Okay. So there has been a lot of said about the participants or organizers of this event. So I do not want to speak about us too long, but please bear with me because there is just one slide where I would like to describe where all this information and experience I'll be talking about, especially from the US, come from. So as Michal said, founded in 2010, we started to help other companies to better understand the needs and problems of their customers and use these insights to create products that customers will love and will be successful. So at the beginning, we were focusing on other industries. We started with banks and insurance companies where, you know, the markets were very crowded and they needed to differentiate, and also other companies joined like energy and manufacturing, etc. And around 2016, companies from healthcare area started to show up, and we started to do projects along with them, ranging from insurance companies, health insurance, pharmaceutical companies, and even some hospitals wanted to work on improving patient care, patient experience, etc. And then I would say the breakthrough for us in this way, at least for me, definitely was cooperation with Czech brand Linet. I don't know if you're familiar with them. In a number of products, they are the biggest bed manufacturer for hospitals and nursing homes worldwide, operating on more than 100 markets. And in 2018, we've met, and basically they told us, we are creating the best beds in the world. And they are very sophisticated. Some of them, they have sensors and they measure stuff and they aggregate a lot of data. But we are trying for several years now to take this data and do something useful with it. But since this is totally new area, it's not a product, it's a service, new stakeholders, new business models, everything is basically new. It's not so easy, and they were looking for a way how to succeed in this. So we teamed up, and the first project we worked on together, we produced this, we called it Safety Monitor, and basically it was an application that should prevent patient falls which is a huge problem globally in all the hospitals and all the facilities, healthcare facilities. But soon after we produced that, we figured out that nobody is interested in more alarming systems, in more systems, because caregivers, doctors and nurses are overloaded with all of these IT technologies. And well, basically, we learned that this is not the right way to go. So we came back to the original discussion we had, that we should better understand the needs and problems of the caregivers. And since the US market was the primary one Lynette wanted to focus on, we went out there, spent some weeks in hospitals and did observations, interviews to get a better grasp on what's that really all about and where the problems and needs are. And after that, we've produced a much simpler thing, which is basically automated data transfer from beds, or some data from beds to the systems that already are in the hospitals, like nurse calls or electronic medical records. So we started to sell that. It was success, but along the way, we also, since Lynette is global,
my jsme samozřejmě díky Lynetu měli příležitost se dostat i na jiné trhy.
The core problems are the same everywhere, even though the different
trzích. Zjistili jsme, že samozřejmě různé.
So that's why we said, okay, so why don't we do something from the bottom up here in Czech Republic? And we called out to our network and put together a platform that we call Zdravotnictví budoucnosti, so healthcare in the future, where we aggregate 70 different, let's say, parties ranging from hospitals, vendors, startups, academia. So we just called out and said, if you think that healthcare can be improved for better from bottom up, and you would like to discuss the problems and start working on solutions without waiting on a system change, let's meet and discuss. So we've initiated this before the COVID, then COVID struck and everybody had different problems, but it's still alive. And then in 2020, a part of COVID, we continued with the cooperation with Lynette and did a lot of projects, few projects, since we found out how complex it is to do IT projects in hospitals, even in the US, or maybe especially in the US. But learned a lot and continued our discussions, and this time on a, let's say, direct level. So we did a research and discussed and did a surveys and interviews with more than 20 directors from integrated delivery networks representing more than 200 hospitals in the US to really help us steer which way to continue with Lynette, and also in let's say digitization activity. So this is the story from where the information experience come from. And now let's jump in the details. So in case you don't follow US healthcare in detail, this is just a very brief overview how they are doing. So basically they are the most expensive healthcare globally. They are taking care of many people, but still 20% of them remain uninsured. So even though they are spending almost $4 trillion US dollars a year for healthcare, not everybody has access to healthcare, to quality care. Those 4 trillion mean 12,000 per person per year. It's almost 18% of GDP. These are official statistics, and 2/3 is paid by government. And the projections are also not so optimistic. They are also official projections. So the growth is estimated for 5% a year,
dohaduje na celých 5,4%, znamená to téměř zdvojnásobení rozpočtu do roku 2028.
A thing that in the US they are not happy about and trying to improve. And also at the same time, they are facing the same challenges probably everywhere in the world. So more people demanding care and less people able to provide it, right? So from this perspective, digitization can definitely help. It makes perfect sense, because it's very hard or even impossible to create more caregivers. But if digitization can somehow help them invest more of their time in patient care, we will increase the capacity for providing care. But I would add, when done in the right way. So let's jump in the topic of digitization. And again, brief summary. So in the US, it all started in 2009 when President Obama pushed through, among other things, also High-Tech Act that basically made all the hospitals and healthcare facilities to implement electronic health records. So basically transfer from paper to ones and zeros. They have allocated whopping $36 billion to support this activity. Originally, it was a 5-year plan that basically demanded that all the facilities provided or did some testing and reached meaningful use. And on the right-hand side, you can see what the stages were and what was meant by meaningful use. Yeah, so all the facilities had to be certified. And in case of success, the facilities were rewarded financially up to $64,000 per physician. So huge money involved on both sides. So if they failed, the insurance payments were withdrawn, which was the case of 1/4 of the market in 2016. So there definitely was a big motivation. The result of this, among other things, is that they have inflated the whole EMR or EHR, electronic health records industry, from 2 billion a year to 13 billion a year. It was something like a gold rush at the time, as it's being described by the vendors. So it was very fast, very ambitious. But the result from the perspective of numbers is that these days almost every hospital has certified electronic health record IT system. So this definitely worked.
Systém elektronických zdravotních záznamů, takže toto z pohledu čísel zafungovalo.
For the patient, what was the impact? Well, there you can find the studies and the results that, of course, when you start doing something new, it's maybe inevitable that the problems will occur. Yeah, so one of the things that was not finished and still it's being a big problem and everybody's struggling with is the interoperability. So basically the systems talking to each other. This was not described, and now sometimes it's a big patchwork of different systems not really talking to each other. So that is one problem. Then, of course, the more you use electronic medical records or anything new for that matter, the more problems related to that occur. So also sometimes some of the systems fail to do what they should do. In this case, this one study showed that 39% in 39% of cases, these systems failed in flagging potentially harmful drugs and even unfortunately caused some deaths. Also, matching of the patients with their records can be a problem. A huge amount of false alarms because all of these systems are trying to notify when something's wrong. And obviously there can be a lot of things wrong when people's lives are at stake. So I would say this information can seem pretty scary, but they are labor pains of starting with something new and maybe rushing too much into it. What impact did it have on a medical staff? And I think here it's more serious because from around 1.4 hour working day of doctors, they still spend with patients only 5 hours, and more than 6 hours is spent with the computer itself, looking into electronic health record. 3 hours spent on something that is really not related to clinical or medical, let's say, agent or specialization. It's like clerical administrative tasks. billing, coding, etc. And on top of that, 1.4 hours of these 11.4 are spent on this after work, and it's not paid. So average doctor does 4,000 clicks of his mouse every day. And there are even big projects in the hospitals how to decrease number of clicks per patient per hour. And these are actually one of the most popular in the US these days, in the US hospitals. On top of that, most of the alarms are false. So people start to ignore it, of course, and that causes the safety issues I talked about. And on top of that, most of the nurses and doctors are trained on something new, being from technology, procedure, or something almost every week. So all of this together is producing the biggest problem that, since we did the survey with those chief nursing officers and directors of hospitals, they placed it on the first place or the second place of the biggest problems they have, which is cognitive burden of their staff. There is too much to digest, think about, and it's just too much. Yeah, so there's no wonder that there are high numbers of burnout among the physicians and nurses. These numbers are from 2019, but if you look at any article or study from 2020-21, it's going to be even worse, also because of the COVID. So many of the doctors and nurses say that EMR and the IT contributes to that significantly. So just for your information, this is how the three biggest players, three biggest electronic health record systems looks like. Actually, this one on the bottom is Epic, the biggest market share, followed by Cerner on the right-hand side. On the left-hand side is Meditech. Different colors, trying to make it more nice, but still you can see there is a lot of things that you need to collect, difficult workflows, and many ways how you can make mistake actually. So how hospitals are trying to mitigate it, of course, in many ways, but some of these ways are were surprising for me. One of very popular ones is like hiring scribes. They call them scribes, and basically it's about hiring people that spend their time with the doctors and are doing record and notes during the interaction between doctor and the patient. Of course, these people needs to be cheap, so they are usually not qualified, and they produce a huge amount of mistakes. So still doctors after their shift needs to walk through all that and correct that. So the error rate is around 50%. Then there is more, let's say, online version of it, which is online scribe or call center. This is, for example, from the Indian call center where they have 300 fully qualified doctors that instead of practicing medicine in India, they sit in this call center, listen to records of these interactions from the US, and do the note-taking in the EMRs for the US customers. And this is much less error-ish, and doctors, of course, love it because it saves them a lot of time. But still, digitization should have spared human resources, not caused that you need more of them. And this is just like funny thing. When I saw that for the first time, I was laughing because those devices are not connected in many times. So staff needs to run around, especially nurses, and like retype information from one machine to another machine. And here are some like innovative tools to help them with that. So gloves with lines on top of that, so that it's easier for them to write on it. I even saw a tattoo on a forearm. But yeah. So one sentence of one of the chief nursing officers we spoken with just stuck in my mind was that she said that they just finished multi-million investment in the smart hospital, or maybe multi-100 million investment, and they still ended up with a dumb hospital because they bought all these devices that are available on the market, all the top-notch stuff, but at the end, still the personnel complains because they all have smartphones in their pockets and they are not able to use it. They are used to, but they can't. Yeah, so because it's not safe and it's not secure, at least they think so, and they make them to use like different clunky devices. So I would say that it would be good to focus not only on like digitization from the perspective of processes and technologies. Of course, these huge infrastructural projects of putting what is written on a paper to write it on, put it in the drawer with some server, it has to be done. But if you do just that, you will end up exactly where a lot of US facilities end up. And I think it's might be a good idea to also start from the other side, from the needs of nurses and doctors. And what I mean by that, this is an example of a mobile application that was created in and by ICEM, which is Institute of Clinical and Experimental Medicine, a very famous hospital in Czech Republic, transplantation center, etc. And basically the problem they had was that they needed at some point document the wounds of patients. So make a photograph, right? And before this application, they were using cameras. They have just few of them. So the personnel had to go look for it, then go back, take the picture, then do the rest of their stuff, and then take the camera, download the picture, upload it in the PC. And it was very lengthy process and things not got finished a lot of time. So along with their vendors, ICEM created a very simple application that is open source. So it is not like a huge software suite that you need to pay millions for on license fees. They created it and secure enough that they can have it, the personnel can have it on private phones. It is available on Google Play. And after logging in with their credentials, they can just simply take picture, upload it, and that's it. So if they were able to do it, I think others can do it as well. So that's why, yeah, and here you can see how it works. You just choose what it is, upload it, and it's there. It's not the nicest, most sexy thing, but it's working and caregivers love it. That's why we put together as a part or as a product of this platform I mentioned, the Healthcare in the Future, we put together a website we call Atlas, which is like Atlas of mobile apps. So essentially catalog of different applications, mobile and others, that we feel might help also other hospitals. And it's available. You can take a look and you can find an inspiration for you, for your facility, or maybe for your startup. If you have application you would like to have there, please feel free to contact us. We will add it as well. It's in Czech so far because this started not so long time ago, but I think this might be useful in the future. So just to wrap it up, I think I really believe that digitization will help healthcare. It's a way forward, but it has to mean less work for doctors and nurses, not more, as we saw it in the US. So I think all digitalizers, let's call them that way, anybody who is working from the technical side to really bring it to life, needs to start from the needs, understanding the needs and problems of people they are designing for. Because let's face it, I'm not a doctor, I'm not a nurse, I don't know what do they face every day unless I try. Yeah, unless I try myself and speak with them and observe, and ideally be in their shoes for some time. And then maybe I can bring something that makes sense, but still it should be designed and validated along the way with them with the users it's for, because otherwise there's a big chance that we will end up with something that we love, but they don't. And I feel let's give people tools that they are already used to using, not figure out new things, because it's gonna bring more complexity into their lives, and it's definitely not necessary and cause mistakes. And it doesn't have to, and it should not cost multi-million-dollar license fee, checks. So open source can be the way to go. Thank you very much. I'm looking forward for the Q&A. If there are individuals who like this and think similarly, please contact me. I would love to speak with you about your ideas. And yeah, thank you.
Thank you very much, Joseph. This was a very inspiring and interesting presentation for me as well. So if you have any questions for Joseph, please keep them still with you for the common Q&A. And with this in mind, I would like to welcome on board the second speaker of today, who is Sofia Couto da Rocha, a Chief Transformation Officer from one of the Portuguese healthcare networks. Sofia, welcome, and feel free to share your presentation on the screens with us as well.
Thank you. Thank you, Michael. I'm going to share it. Oh, 1 second. Oop. Okay. So thank you very much for the invitation, and thank you, Joseph, for that first presentation, because many things I'm going to endorse them actually, and to give some examples from our side. So I think it's really interesting to have this sequence. So it's not new that, of course, when we think about transformation of anything, we normally think about people. So you cannot transform a society or an enterprise or a system if you don't think about the ones that compose the system. So here in digital transformation, I think sometimes we in general tend to forget that it's, again, all about people. So just to give you an overview of what I'm going to cover today, I'm going to start with the context, namely about Portugal, how the healthcare system works here, and the main players. Then regarding innovation, how we can think about it on that context and how we work it. And then how we apply this innovation in reality. So how do we really transform what we have and what we had previously, and namely a little some examples of what we've done during COVID time. With no further time, so regarding context, for the ones that are not familiar with the system, in Portugal we have actually a beverage model, meaning that government provides healthcare mainly to all citizens, and we have, of course, overlapping with other.
Je to všeobecný státní zdravotní ústav, systém zdravotní péče, a potom jiná schémata. Jenom abych vám ukázala příklad, je to EIT.
It covers all public workers and their families. To give you an idea, all those special public and private insurance schemes present a quarter of cover a quarter of the population, and then private voluntary health insurance another quarter of the population, roughly. Then when we see the health market size, this is previous COVID, of course, in 2019, you can see that it grew a lot from 2012 to 2019. Nevertheless, the distribution is quite the same, mainly public administration, some insurance companies, out-of-pocket investment, and then non-profit institutions. So the proportion is, again, roughly the same. Then when we think about the capacity, just to give you an idea, we are a small country, so just to have a number, we have around 240 hospitals, with public 108 and private 127, and then 3 PPPs, which are partnerships, public and private. So it's a specific way to manage hospitals here that actually are reducing in number. And in number of beds, we have around 36,000 beds. with all of this together. When we think about going deeper in digital, in 2017, there was a resolution that decided to support digital health here. And that was probably one of the most important markers, because here it was the main player or the fastest player to apply a new investment and innovation in healthcare system for the digital area was the public system, and it was clearly a top-down approach. So SPMS, which are, if I translate as the shared services from the Ministry of Health, it's an entity inside of the ministry that deals with all the electronic health records and all the digital systems in healthcare. It turned to be part of it a manager for healthcare electronic records also, but also a software house. Because we have, when we compare our reality to the big five that we have in Europe, namely, we have some aspects that might not work in favor for us in other fields, but in this field are quite good, which is we are smaller and all of these systems are centralized. So whenever you want to apply something new or to improve or to change, it turns to be, of course, easier, and it allows us to have some national-wide digital projects, which is why probably one of the main reasons we have such a development in this specific field. And just to have you a number, to give you a number in something that is quite interesting, is that even before the pandemic, we had 92% of patients with that left, when we think about it, that go to a consultation or a hospital and that just go with electronic prescription. So paper free, not free totally. We always have the second options whenever, but almost paper free in medical prescriptions. I put you there another entity below SPMS, which is Estamos on, which means we are on. It's a new website where not only the Ministry of Health, but all the ministeriums centralized information.
Kde jsou centralizované informace právě týkající se v tomto případě konkrétně pandemie a co jsou vlastně největší výzvy. Myslím si, že to je to, o čem vlastně hovoříme, je nějakým způsobem posilování lidí, zdokonalování jejich elektronických.
If you have your vaccines, having your prescriptions online, everything, but sometimes people just don't know where to search and how to do it. So this raising awareness of what you have and where you have it is really interesting. And then a big discussion, not only for Portugal, but for everywhere, which is interoperability, not in terms of technically, but mostly commercially, or in terms of compliance, authorization, ethics, and so on. And then some investments directed to imagine interoperability in semantics or other areas that might have a huge impact on the daily basis of doctors, nurses that really have to do all these writings around all the daily basis job. Then we have, just to give you an example, on the left, you have a lot of different softwares that we use in, also in private, in some of them only in the public sector, others in private too. Then they all have to be available for most of the stakeholders, going from providers to payers, if we think about the state or even insurance companies. And then they have to cross with drug circuits, clinical information, electronic health records, logistics, HR, and so on. So this is really interesting that we are not talking only about healthcare, digitization, but also when you think about the full ecosystem in a digital world. Some numbers from patients, some numbers from professionals. We did a questionnaire by by the end of 2017, and 90% of the people said that they really research about health online. They gave us some more detail on that. So they research about therapeutics, disease, healthcare providers, and so on. But the detail that was the most interesting for us, which was only 20% believe in what they read. So there's here a problem between literacy and between what people want to find and what they are willing to believe in what they are searching. On the other hand, if we think about the professionals, and those numbers are also from the same time, 92% of doctors and nurses ensure that these electronic healthcare records benefit the patient. So there's a recognition of that they do an effort to use it, but there's a benefit for the patient. But then think about the change. Only 62% are comfortable about using it, and the worst number for that was when we separate hospital doctors to primary care. Primary care were the ones that were less happy about electronic health records, or specifically using it. And as we know, most of the numbers that are shared with you are previous COVID. And VUCA concept is not new. It has, I think, almost the age of that we are now, meaning 30 something years. But the thing is, probably it never made so much sense than now. We are totally in a volatile world. Uncertainty is normal. Complexity is raising more and more, not only regarding digital world, but if we think about what we can do with technology and what we should do with technology and all of the discussion around it. And of course, there's ambiguity and uncertainty with ambiguity together, that we don't know how to do it and where are we going. So in that point, and if we assume that this is that volatility, uncertainty, complexity, and ambiguity are normal, we start to think on the top of that. And that's an invitation that I always do to everyone, like accept that, acknowledge it, and then go further. And when we jump into digital worldwide, which is when we talk about digital, is really hard, as you all know, to talk about a country or a system or a field of knowledge, because digital, something that is transversal, it has no barriers or a very few frontiers. So when we see the digital health market size in globally, it's really interesting to see the change. When 2019, we had 106 billion US dollars calculated, and the prediction, and it's a conservative one, for 2026, it's 639 billion US dollars. There are no other industry that jumped like that. So this, just to keep that in mind, and all the volatility that we talked about. We asked again, and there's a lot of different research about that, about the professionals, how was the perspective of healthcare professionals to the digital world. And it's interesting that after COVID, confidence raised. Normally, with the previous research we've done, confidence was, as you saw, happiest actually. Happy was around being happy about using it, 62%. Confidence was around the same value, and now it jumped to 92%. Then the boost in technology adoption due to the pandemic is acknowledged and recognized by the professionals. They also refer low adoption in 4.0 digital solutions, a lot around what Joseph said, that sometimes we invest a lot to develop the full system, and then the small things like making the blood pressure system connect to the computer, we don't do it. So that's a full perceived reality from the professionals. And then the uncertainty about technological application, and also the training that is normally considered lower than what they actually need. With that in mind, when we thought about transformation, and now I'm going to my daily basis actually work, meaning transformation in healthcare in our institution, we designed actually 4 pillars associated with a 5th one, which is intelligence, because we need to think about business intelligence, health intelligence, and all the information we can collect in the basis. But just to give you an overview, to think about healthcare transformation, we definitely expect to have, of course, operational efficiency, cost optimization, rise, the capacity to reach more people, but based on what? Always on relationship, either with the users. And when I say users, I include doctors and I include patients, and all the other stakeholders are engaged that we saw a little bit before. And of course, professionals and teams capacitation in the daily basis problems. That's one of the main issues that normally we assist in digital, is that conceptually we solve the full problem. In a daily basis, we find problems that we, even when we do all the tests previously, we don't find them. So, and in terms of looking, we actually look to people and technology in that way. First people, than technology. So just to finish this part of context, I went from the world to our reality. And in terms of methodology for innovation, I don't want to be, I don't want to go deep, but just to give you an overview of how we think about it nowadays in our institution for healthcare. We accept fully that we are not exponential like technologies. So this is very important in terms of discussion of ethics, of decision-making process, and data governance. And with that in mind, we are aware that we have a two full hands of new technologies that are really interesting, either for artificial intelligence or for the capacity to deal with all of that in our mobile, or to amplify the capacity to save data with the cloud, or to go to precision medicine, starting with genomics and going to robots, and then to IoT and the follow-up outside of our hospital walls. But to be sure about that, we have to also accept that normally whenever we have a new technology, we always know that everything thinks that expectations are on the top of it, and they are more than inflected. We are probably assisting to that in artificial intelligence, similar to what it happened a long time ago when we started to have light and we applied electricity to everything. It's kind of the same mindset. So we are really aware of that. And that's one of the important things for piloting, namely in healthcare. As you all know, in some fields of technology, like biotechnology, healthcare is really highly developed. But in other fields, thinking about software development and application, we are probably one of the last ones, the last ones to apply. And then I was trying to select only a few trends. Actually, I wanted to select 5, but then it's a little bit harder. So we went to 8 global trends for the future. I don't want to go deeper, probably all of you are quite aware of it. But one very interesting detail is that we started to have new players in healthcare. They are not that used to the ecosystem of healthcare, with good and bad things regarding to that. But one of the things that I wanted to focus actually is in the obvious, which is the drivers or blockers, the players that actually play the main process here. Either payers, which is the first word, I'm sorry, it's not players, it's payers, either the funding side or policy making, how technology is going to get along with the ecosystem, and most of all, how customers, and when I think about customers, is consumers, meaning doctors that use the technology to proceed with their profession, or the patient that actually search for healthcare or for information or has already a disease. And then if we think about all of those technologies that are really, really very exciting that generate a huge excitement to apply, then how can we fund it? Because most of the times we also know that healthcare in terms of insurance might have a good return on investment, a direct return on investment for governments and for hospitals, either private or public. The return on investment is a little bit harder to handle and also to justify. So how do we fund it? And we have a lot of process for innovation. So we can go for social innovation, we can think about gamification, we can go for crowdfunding or crowd-based innovation, both of them a possibility. One of the things that I wanted to ask you to focus on is co-creation. Most of the times we have the most important people, the most important people in our team without looking to it. So most of the times we search for something outside, and then we have the user, we have the blocker, a stakeholder, we have the stakeholder that might help in the payment or in the ecosystem involvement. So let's go on thinking about co-creation. That's one of the challenges that it was probably one of the best things about the pandemic, that we started to have cooperation much more than we had before. And not to be too extensive on this, but we all know that many people divide innovation into disruptive or incremental. I don't want to go on that part, but I want to make us think about it, exploitation or exploration, meaning exploitation of what we already have for business. That's what's most of the time happened with the pandemic. We had some conditions and we had to develop them to give answer to new conditions. And then we have, of course, exploration with open innovation. And normally that to implement is a much more top-down imposed than bottom-up. So thinking about the left downside, which is normally bottom-up,
vlevo dole. Většinou to je směřuje od spoda nahoru. Někdo, kdo má problém, se snaží jej řešit, snaží se nějak
easier to implement. And if we think about it in the bottom up area, normally when we acknowledge the existence of this innovation in our system, it's already implemented because the person that's thought about it already is already using it. Closing this version of innovation. So we went from the context to what we have by now, of course, in a very fast way. I'm sorry if, of course, then we want to discuss some of these topics deeper, I'll be very glad. But just to give you an example on how we applied this in the context of the Portugal healthcare system in COVID time, because I wanted to go to this most hard moment that we had recently, and just to give you some examples of how we apply this co-creation most of the times there. So we were really aware of that education literacy was core. Think about doctors that normally are have a lot of information to deal with patients and disease. And by that time, COVID was new. So even if we wanted to research, we couldn't find, or we could find some things, but we didn't know if the source was the best one, and we didn't have time actually to collect information, select information and learn it. So we separate teams, specifically highly qualified teams, to select information, digest information and share it in a very easy way, either in videos, in short podcasts, in whatever we could to reach our clinicians, and it was open, of course, for the outside. Then another thing that it was purely co-creation was this app that was born out of in our program of social responsibility that we did without systems, a company that works actually software. It's a software development company. And what we've done was we were in March 2020, and people, all the lines, public lines were full. People couldn't call to talk about the symptoms. And if they go to the hospitals, they would be invited to go back home. So we did this app with starting with 3,800 doctors and registered nurses, all with volunteer work from Lusíadas and outside. So it was open to all professionals that wanted to come in. And there was a program with artificial intelligence, an algorithm, actually with machine learning, that asked about the symptoms and computed the symptoms with all the information that we had by the time, reading papers, and access the probability to have COVID. Giving one of three colors: green, low probability; yellow, medium, probable; and red was with risk symptoms, and we sent directly the patient to the hospital. In this yellow output, there was a chat that was open to these professionals, that's these volunteer doctors and registered nurses that could answer the questions that people have, either evaluate if they should stay at home or not. And all of this was open to the next professional that that would do an evaluation. We also had the artificial intelligence assistant. That was really interesting because he could answer something so basic like what is COVID-19, or something a little bit more complex like why are we using negative pressure rooms for COVID patients. So just to improve literacy and to make people reach really credible and good information. We received some prizes regarding that. It was really a very interesting thing. And we developed it with volunteer work from both teams, OutSystems and ours. And in 7 days, iterating every 4 hours, literally. So midnight, 4 a.m., 8 a.m., so on and so forth. And we tested it during this time with real users, and it was really interesting how actually when we want to do it, we can co-create from and bottom up and support it with our top management, which was also something very interesting. Then because we knew that professionals were in the front line, mainly not only the ones in the front line were actually in burnout. So we did a burnout evaluation screening, and we did some focus groups to understand what we could do, to listen to them, to actually ask, how can I help you? Because it's not that easy when you are in the in the office, taking decisions about circuits and about how the hospitals are going to be organized, to know what's happening in the front line. And it was really interesting that some of the outputs were so simple, like having a space to rest for 5 minutes between patients inside of the COVID area, or having some image in the wall that makes recall a beach or something that was, you know, good to relax. And then most of them asked to have this paper with the image and the name, so that people could see that they were people between colleagues and also with patients. And now this amplified, and it's going to nutrition, metabolic, and mental health support with a variety of initiatives. Then we changed also, we were in the middle of our digital transformation regarding users interface. So we were actually finishing the first phase of our app and web portal when COVID started. So everything changed, and in some month we had to change everything that we had, not everything, but most of the things we've planned. So there was a new platform launched exactly in the middle of the pandemic, so September 2020. And we went to the field every time we decided a new feature, we tested the interest of this feature, either from the patient, either from the doctor. So it was really a different mindset on how we built it. And we were actually one of the first in the market, actually the first in the market to have some payments and check-in features that were fully automated and people didn't have to touch anywhere. And the people we have to receive our clients and our patients in the units were actually to say good morning, to ask if they need something besides all the process that normally, all the bureaucratic process that normally it's not that interesting for both sides. And then something that came from the outside, but as we all understood, pandemics are prepared before to appear. So in one of our hospitals, which is a PPP, a private-public partnership, which is Hospital de Cascais, we have HIMSS 7. HIMSS classifies the maturity in technology applied to that has useful outcome to users and patients. And it's interesting because the concept is totally to have high tech, to have high touch, so that it's a better high care. Explaining a little bit deeper, high tech focus in quality and safety, to have all the drug circuit closed, to be sure that we are giving the specific drug to the specific patient in a specific time, to be safe about the procedures and the treatments, but also to give time to nurses not to be near the computer. So we have small iPads that go with the nurse, with all the materials that nurses need, and with short-listed answers like yes, no, with easy registration, some of them automated in the system. And of course, it gives more time to have high touch, meaning to be humanized and to be humans contacting humans and not humans computer humans. So it's also something interesting because resilience was tested during the pandemic. And of course, this works better than in another organization way. Just to finish, and something that I wasn't sure to bring or not, but I think one of the questions that I received the most in this type of meetings is how we do it in practice. We use agile methodology. We try to use it. Of course, to big organizations, it's hard to be really agile. But when we think about technology transformation and innovation, it's hard not to be agile, because whenever you program and you plan a project, if you go further than a few months, the probability to be wrong is really high. And then you end up failing very expensively. If you don't ask your users, if you don't do UX and UI really iterative, really in the field, it doesn't work. And so I put it there in dark blue and then in lighter blue, because we develop, we test, we evaluate risk, and then we develop and we test, and this iteration over iteration over iteration, sometimes even in the same week for a feature that we were certain that it was okay for a month. So this is really interesting to think, how can you apply this concept to the organizations, even if it's a country, meaning it's not difficult if the mindset has changed. And then again, always thinking about digital. we tend to think about online and then we think about offline. This doesn't happen anymore. We don't have offline care and online care. We have care, and we have touch points that are online and offline. And this is very interesting to think about the customer journey. If we think about your user, what is going to happen to him? Meaning, if me, Sophia, wants to search for a consultation, what do I do? Do I search online first? Do I call someone? What do I do? When will I interact with different players, with the ones that are offline and the ones that are online? So this concept of integration, I think it's probably one of the hardest ones and the most important ones. And then we know that this is a reality. Like when we have people, we have to be aware of the need for everyone. So not putting technology as a hype that we want to apply, but use it never and only if it helps, not if it's cool or nice to have. And that's something that we tend to forget whenever we are excited about something new. And the last concept that I wanted to share, it's a very basic one. This is a picture I took from a wall in the United States, actually, that was really interesting because it's applied to almost all projects and specifically in digital, which is we normally have the opportunity to have a good product, a cheap product, or a fast product. But something that we cannot have is the three at the same time. So sometimes to go for a minimal viable product, we might go for something fast and cheap to test, but it might not be good. Or sometimes when we want to go deep in something, maybe the fast can just stay away and just be good and cheap, but it's not going to be on time probably. And for Agile, time box is really important. So just to always have that in mind, because sometimes the ones that take the decision are not aware of these impossibilities between these three concepts. And of course, thank you very much for your attention. And for the ones that take decisions and for the ones that follow them, just stay curious, because if we are not curious about what we have around, if we don't ask, we will never know. Thank you very much.
Thank you very much, Sofia, for all your great inputs and experience from Portugal and your own healthcare network in Portugal. And with this in mind, I would like to welcome on board the last main speaker for today, Joanna Stupari, a Senior Manager and Compliance Officer from Health Cloud. And I'll be very happy to hear what are the implications of all this for the privacy, data, patients' rights, and the health data management. Joanna.
Hello, Michal, and thank you for giving me the floor. Thank you, everyone, for the great speeches. I think, yeah, we've heard some great use cases and lots of very interesting trends and very accurate that depict how the healthcare digitalization process looks nowadays. So thank you for a very, very good paving of my speech, which is more meant to highlight some of the concerns that come when we speak about digitalization, and which concern one of the core stakeholders in the healthcare process, which is patients. And from all the problems and all the rights that patients have, I chose privacy because due to the amount of digitalization that was forced upon us during the pandemic, privacy has come as one of the strongest affected during the pandemic. So basically in my short speech today, because I chose to speak very briefly and highlight some of the key issues that I encountered in my professional experience and academic experience, and then rather open the floor to questions from you and ask you to engage in a discussion on this and what your experiences were. And that's why my key message today, or my aim today, is to see how we can find the right balance between innovation and digitalization and privacy of patients. And when I speak about privacy, I'm sure you know that I speak about GDPR as well and other data regulations, which are something that have been very, very, very important in the last 2 years, since many healthcare providers have started to move towards using digital means in more operations than ever, because my experience so far has been with both hospitals from Eastern Europe as well as from hospitals from Western Europe, countries such as Croatia, Hungary, Austria, or Germany and France, working both for the hospitals as well as for the technology providers. So I've seen both sides, and I've always tried to identify, to find the right spot between how much data is sufficient to share, how much data are you allowed to share outside your organization so that you don't encounter legal risks, so that you don't infringe on your patients' rights. Because the first duty of doctors and of healthcare professionals is towards patients. And privacy is one of these rights that we so sorely need to protect. And during the COVID pandemic, I've encountered two different types of hospitals. And this is something, of course, a more recent problem, but I think it's a good description of what is to come, because there's two type of institutions that have not been fully digitalized, and that depends on the part of Europe. Like countries in the Western or Central Europe have been more digitalized than others, while countries in other parts of Europe have had more reluctant approach to adopting EHRs and digitalizing health records and adopting digital tools in patient management or in tender management and so on and so forth. And I've encountered two types of attitudes. One type of attitude was, okay, we have to digitalize because, you know, we have to make sure that patients are taken care of, and we cannot, you know, meet with them face to face. So we need to find solutions to allow for this to happen. And we also need to continue to provide data or to be engaged in clinical research, either for commercial or for academic purposes, you know, to continue that source of funding for hospitals. So this has been one of the attitudes. And the second one was, okay, we've done it already. We are very advanced in this, but we are very reluctant to share data. So on the one side, I've seen hospitals that I've interacted with hospitals that were, okay, we are new to this. We don't really know how it works. We don't know how to select the technology providers that are able to provide patient safety and privacy rights management and respect. And, you know, this is one discussion, one side of discussion, like how do you select the right technology enabler? How do you select the right technology, you know, to be able to ensure that you're doing data management and patient management right? And on the other side of the story, we have the hospitals that are very reluctant to sharing data, which sometimes can impede on research. Because of the digitalization of the healthcare space at a global level, a lot of the pharma companies and the CROs and usually the entities that are engaged in clinical research started to look at patient data from all over the world, you know, to carry out COVID vaccine studies or COVID medication studies. And for this, you suddenly needed a lot of data from a lot of patients in a very short period of time. So basically, and this is something that is not only related to COVID, but has been fast forwarded due to COVID, because, you know, this has been a trend that has existed before. So we've seen this need for using data from hospitals that hospitals had. We've seen a lot of budget and a lot of projects and a lot of initiatives to extract the data, to use the data to conduct research, but we did not have, or we did not see the know-how to use the data in a way in which you don't step on patients' privacy. And this is where we come in, because basically there's some solutions currently, or there's some guidelines currently that make sure that patients' rights, privacy, or other types of rights are respected. And we look here at, for instance, European regulations like GDPR. We look at guidelines that come from European agencies that basically show you what you should be careful at when engaging in medical research, when sharing data. There's lots of medical standards, there's lots of legal standards that tell you what you should be looking at when you select an EHR provider, when you select other technology enablers in different parts of operations. when you decide what to share and with whom, what types of rights you give to patients and to doctors and to nurses, so that you don't, again, bring upon yourself legal risk and you don't disrespect patients.
Zachování soukromí údajů. Takže máte celou řadu informací.
Healthcare provider that tells you what you should be looking at when selecting such software solutions. And on the other hand, we look at technology providers, the ones that are supposed to design solutions aimed at solving all these problems and making, hopefully, healthcare faster, cheaper, and better, ideally all three at once, right? So my message today is also towards these type of companies that are actively designing solutions to make digitalization possible. And for this, there's two principles, very simple ones that I recommend and I want to raise awareness over them, that they are very important. They're called privacy by design and by default, which means that from the very start, when you identify a problem and you want to build something to solve that problem, like for instance, the fact that patients and doctors should be able to safely meet online in telemedicine solutions, or the fact that you have a problem with interoperability, right? You have so much data in so many languages, unstructured, which you cannot safely pull, extract, and read to gather insights, invaluable know-how, so that you can make decisions at, for instance, a country level. Many countries don't have that, and they've been hit when the pandemic hit, yeah, that's funny, when the pandemic hit, because they weren't able to know what was happening in their country. So basically, privacy by design and privacy
by design a privacy by default je důležité vždy myslet právě na ochranu toho soukromí.
Solution, so that you can make sure that when you go to the hospital, they will know and you are able to prove that this is respected. And this is one of the most important things nowadays, and this is one of the biggest concerns that, in my experience, healthcare professionals had, at least at the hospital management level, because they are the ones that we were interacting with. Okay, I agree to share data with pharma companies or CROs for research, but how do I know that the data is protected? How do I know that that there's no legal risks for me and for the hospital? And how do I know that patients are able to safely exercise their rights? And I want to tell you just a bit, and this is my last point, about how one of the companies that I'm working with, HillCloud, which is an Austro-Hungarian company, a startup that has been working exactly on this point to try to offer a solution, to construct a solution that is extracting data, patient data from hospitals, EHRs, regardless of whether it's structured data or unstructured data, like for instance, doctors' notes, because Josef mentioned lots of note-taking from doctors, regardless of the medical vocabulary used, aggregate it, curate it, and make it ready to use for research. So that research is faster, so that the clinical trials no longer take 10 years, like the average duration of a clinical trial, according to statistics. And so that they no longer cost $2 million, like the average cost to get a drug on the market. These are problems, very strong systemic problems that healthcare has, which the software that HillCloud has built is trying to solve. And all this with patient privacy in mind, because without it, you cannot enter into any hospital, and therefore you cannot fulfill your purpose. And I would recommend any software provider, any startup working on it, any large company, anyone that's looking at us today or will be listening to this, to just think about it and start discussing, start researching about how to make sure that from this perspective, the solutions that are being built satisfy all these requirements. It's not just a competitive advantage. It's also it's a prerequisite. It's a necessary thing in the age of digitalization, when everything is going digital. Whether we want it or not, more and more of the patient-doctor interactions will be digital, and we need to be ready for it. And with this, I want to invite you for questions. And if you have any questions or any request for more information, I'm happy to provide. I hope the points that I made were interesting for you as well as they are for me. And yeah, happy to have a discussion now. Thank you very much.
Thank you very much, Joanna. I'm so happy for such a flow of these presentations. We were able to listen now. So we're talking and looking at digitization in US with some implications for Czech Republic, transformation and digitization in Portugal with some of the cases from there, and also the privacy data. So with this in mind, I would like to, of course, say thank you to all of the speakers and open up the floor for questions for any of the three speakers that we had. Please use the functionality of raise your hand in order to ask anything live. For me to give you a word in Czech or in English, or write that into the chat. We are now turning into the Q&A session. And obviously from my side, the first question which comes to my mind to be the first one to ask is, given all these perspectives from the US and from Portugal, it will be really great to know where we are with digitization of healthcare in the Czech Republic. Josef, can you give us a more perspective on that potentially?
Well, honestly, I'm no expert on that because we were focusing mostly on abroad. Yeah, so I can just give you my feeling, which is coming from the trying to creating a product that are meant for abroad, but are being born in Czech Republic and obviously tested here in Czech hospitals, right? So, and please, all participants, correct me if I'm wrong, because I'm sure here are experts on this topic much bigger than I am. But my feeling is that here in Czech Republic, we are definitely not in the beginning, you know, on the start. There are many hospitals, or I've seen hospitals or units that are fully digitized, but it's not so spread as in the US. And that's why I thought like now it's a good opportunity to learn from what others did, let's say suboptimal, and bring in also other parts of the necessary, other necessary parts to succeed. And I think Sofia gave us very nice example how they are doing it in Portugal. So I like that very much. So I hope that something like this is going to happen here as well.
Thank you, Josef. Mr. Zeman, Ministry of Health, what is the current, what is the current status, and what are the next plans in terms of digitization of healthcare in the Czech Republic, if I can?
It's not easy to comment these presentations because I feel that our position is different. We are building the older elements of ES, like infrastructure, transport infrastructure for medical record exchange, like registries of healthcare professionals and healthcare providers, etc. We are at the starting level with the e-health legislation in our country. The first law is in Parliament under the negotiation. And but what is positive from my position or in my role is that we are not the innovative institution. We have other tasks at this time, but we have prepared a lot of projects or projects plans for funding from EU funds and from national recovery and resilience facility plans. And in this project, with allocation of billions of crowns, we have the project proposals for innovative technologies, mHealth, telemedicine, for digital health support of rare diseases, or for example, for next I have here. Yeah, the very important topic for the next years in our country and in Europe is the secondary use of health data, for example, for research. It's very important, and we are at the beginning in our country. Then we have a lot of money for cybersecurity. It's in relation to data privacy too, and for building interoperability of health record. So I hope that we will finish the next 5 years like a modern country with health infrastructure with at the same level as our friends from new countries with, for example, mobile applications, as we see, for example, in ICAM. ICAM is a very good example of what we need to do. So it is my comment.
Yes, thanks very much for giving more perspective on that. Please feel free to put your question in the chat or raise your hand so I can see it and I can give you a word. In the same time, before you write that question or raise your hand, let me follow up on the applause from Joseph. From at least the list of the applications that you have, what would be potentially other needed requirements that the doctors might have in terms of having such small digitization processes required on the market, Joseph?
Sorry, Michal, come again.
The question was because you presented only one of the solutions that is now presented under the Applause. Some of the solutions that are already used by the doctors and hospitals in the Czech Republic. What are some of the other cases on the Applause used by the doctors, and what are the, let's say, most hot requirements by the doctors for having such small innovations like that?
Yeah. Okay, so maybe let me split my answer to two parts. Like, first one is the Applause is something that is trying to help create more islands of positive deviation, and that's what's out there right now, right? So some hospitals are creating something very useful for them, and we wanted to provide them a chance to share that out, because it's not a systematic way how to develop in these let's say well, in the teams mixed from doctors, engineers, as Sofia said, because this is something what I don't see too much in Czech Republic in general. Everybody's focusing on, okay, let's put money to the technologies and let's buy these things, but this approach is leading, and we saw that in the US, to having a lot of technologies in the hospitals, billions invested, and then the people who actually use it say, yeah, this is a step forward. Like 60% of doctors and nurses say in the US, yes, this is a definitely step forward, and it improved patient care. But yet 60% of doctors and nurses say, but we need to overhaul it completely. We need to start over because we cannot use it. It's too difficult, right? So what I was trying to say was not like, let's start doing these cherry picking small apps, but let's focus also on usability, right? And to your question, well, currently there's like 10 applications, so it's really small. And what you see there is nothing, I would say, wildly innovative. No, it's like people need to share the information, right? So there are like messengers. You have WhatsApp, you have Messenger, you have, I don't know how many messaging platforms in your phone, and people need to communicate even in the healthcare setup, of course, but there are these privacy issues, as we've heard from Joanna, of course. So that's a problem. But as one of our attendees or members of the platform, being doctor himself, said, it takes me half a day just to get patients' information from some other department in my own hospital, because I cannot look for it. I don't know where to look for it. So I'm calling there. They told me that there is a doctor who has this information. He's not there, you know. So there is like a huge effort of getting information that should be a pretty simple task. And in other other scenarios in our personal lives, you have it at the reach of your fingertips. So this is one thing. There's many of let's say needs like this, and they are not so sophisticated. No AI, nothing like that. Just pretty simple stuff. So yeah.
Thanks, Joseph. I'm just looking around for another question, please. It's not just about me.
Can I make a comment on what Joseph said?
Sure, please. Go ahead.
Yeah, I wasn't sure if I was allowed to intervene. I just want to follow up on what he said, and that's precisely my point, that sometimes privacy, while important, is taken too far and is used as a reason not to share information or not to use like health data, for instance, for secondary purposes, like Mr. Zeman said. So I think that's why we have to be aware of it, but not exaggerate and not start putting the argument, yeah, I can't share it because of privacy or because of GDPR, because it's not the case. You are allowed and you should be able to advance medicine, to do medical research, to share information with other doctors. But the systems that are in place should facilitate this in a safe manner without taking too much of your time and without putting too much of an administrative burden on you as a doctor or as a patient. So I totally agree with what Joseph is saying.
Thanks, Joanna. And by the way, what is the status of digitization of healthcare in your country?
I'm Romanian, so by nationality, it's not great. Yeah, we don't have the level of interoperability is very low. We barely manage to digitalize health records at the hospital level. There's a lot of providers, so because there's many providers, there's many systems with different standards, and security is not the best. So the issue of cybersecurity, a hot topic for us as well, besides privacy, unfortunately.
Thanks, Joanna. Ms. Chlebna from Czech Invest, would you potentially have some questions on some of the speakers that we had?
Yes, I can. I will ask Sophia about how they achieve the political and social agreement on rules set up by GDPR in relation to the healthcare systems. Because I guess that Mr. Zeman will agree with me that this is an issue in the Czech Republic. So what was the principal reason that made you succeed to get that political, say, agreement?
So thank you so much for the question. Actually, one of the fields that I'm dedicating more now is actually GDPR, as of course, because it's sometimes, like Joanna was saying, one of the reasons that we use to block. And most of the times, if we deep dive the subject, if we cut it into pieces, it wouldn't block. I don't know how it's the reality in Czech Republic on that, but we had this law previous to the GDPR that was really similar. The only difference was that we didn't have to pay the high amounts if it's not comply with the law. So that was the big difference in terms of being afraid or use GDPR as a blockage. In terms of agreement, we are still in a way for a shared or the concept of data lake of healthcare information, because we have between the public hospitals, we have a platform that it's called PDS. It's a platform to share data, where if I'm inside of the system of a public hospital and I'm seeing the patient Maria, I can find all the records and the access of Maria in all the hospitals and primary care centers nationwide. So I can access where did she go, when, what did she do, if it was a surgery or something. Only inside of the public hospitals. One of the discussions now is exactly that, if we should amplify that to private sector or not. So if we should have an MPI, and master patient index for a patient around the system, national-wide or not. And that has been the discussion, because most of the people that are against agree that patients search for a private hospital because they don't want to share their data like that. And the other ones say that some specific data might be life-saving, imagine allergies, for instance, so that if you arrive to a public or a private hospital, the doctor should have the same level of knowledge. Nevertheless, and with that said, the option that was taken for public health was opt-out. So everyone is in, except if they say that they don't want to be. Mm-hmm. And that was quite interesting, because when it was discussed, it was agreed almost all over the parties, left and right wing, with the reason that information was already shared. So we already shared information in paper. We sent a big group of documents to other hospitals. So the reason was, we already do it. With that electronic healthcare records shared, we have tracing of who accessed it. So we know who accessed the information, when, from which hospital. And we also can monitor the information, because information is in one place. It's not moving with the probability to be lost in between the system. Some processes were lost, really lost, because they were paper. So no one knew where the paper was. And with that concept, two basic ones, it was quite easy to move for this shared space. With another, when the GDPR entered in 2018, one change was made, and it was quite mature, and I'm very happy for that.
A začalo se využívat.
Access to everyone that accessed his medical record. So by the phone, we can download an app that shows me who accessed my file. And if I want, I can ask for, of course, to be cleaned my information. Until now, there are a few number of people accessing this app. It's not it's not used by everyone. That's why one of the questions was to raise awareness, to make people know that they can search for this. And the other thing is, normally people don't, when many questionnaires were done to the population from private entities, just to know what people think about it. And they were very willing to share their clinical information inside of the system. So there was no issue regarding to that. The literacy regarding data privacy and risks and monetization of data and all of these thematics around the population is really, really low. So
thank you very much. Sounds reasonable, but try to persuade politicians to behave logically.
Exactly. Thank you very much for the question.
Please. We can hear you, Josef.
Sorry. Yes, I also have a question for Sophia. It's a similar one, but how did you persuade all the stakeholders to support this way of operations? You know, because here in Czech Republic, from my previous experience from public sector, we need to tender, and you know the key topic is efficiency, and basically it has to be cheap, as cheap as possible. And when you are dealing with such a complex issues, you need to invest a lot into work before you start programming something. And usually what happens is that in the effort to make it as cheap as possible, these parts are being cut off. So my question is, how did you persuade all the stakeholders to support these multidisciplinary teams to exist, to work, to be paid, and iterate? Because this is not how it typically works here in Czech Republic, from my experience.
Honestly, thank you again, because the questions are really, really interesting, and are questions that normally we have to answer every day to make the projects go. One of the things here, and I'm probably not going to be very consensual on that is that we tend to make cotizations of software really high. So normally things cost really, really high. And the decision-making team don't have people inside of the team that normally can discuss these values with them one-to-one. So what we started to do is to make these multidisciplinary teams around money and efficiency first, meaning what I'm going to do is going to make people happier, it's the process more efficient, and is it cheaper or not? Because if it's not cheaper, I have to justify why it's not cheaper, why I'm moving to something that is not cheaper normally. Because when you think about payment, and of course, money is always a problem to talk normally in some environments because it's healthcare. But it's normal that we talk about money, because if we improve cost efficiency, we can reach more people with higher quality. So I have no problem at all as a doctor to talk about money. So if the issue is normally money driven, so let's cut the pieces on the money. And that's how we normally start. And the thing is, when you put those people in the decision-making committee and in the discussion, the negotiation process, normally prices will go really, really low. And in software-wise, because we normally know that I have a startup, and of course, if I sell my startup or my product to 1 million people or to 100 people, I'll have most of my fixed costs are the same, except cybersecurity that I have to amplify. So when sometimes some big players come to us and discuss some values, we normally cut it by 1/5, 1/3, depending. So already on that, we have an easier way to implement. And the second step is nowadays, without a doubt, what the highest value is in data. And normally people tend to sell us as the value being software, in the technology. So if I have the doctors that can make the guidelines, all the process, imagine about IoT, about telemonitorization, who knows what is needed to be monitorized? Doctors and nurses. So, okay, so this is the capital. Then who has the patients? The hospitals or the governments? So here's the capital again. So what do I need? Software and cybersecurity. So what's the cheapest part here? It's normally that. So we have to cut the part with pieces and be really direct with some players that were normally working in medical devices, large medical devices, are now moving forward to towards to small medical devices and software development, normally making a packaging about consultancy. So we need consultancy in some areas, in others, no. We are normally the providers of consultancy. So I think governments can really lobby on that. I mean, lobby on that point, like being, the value is here, the data is here, the professionals are here. So let's cut it into pieces. And when we talk about this, it's also very important, namely to Horizon 2030, because when we do big consortiums and we share this, like to ask for investment from EU in large values, we normally tend to have hospitals with the lower part of the investment, which is also nonsense because it's where you have all the capital. So I think that the point is like that, make people that really know about it to discuss with others, because like that is really hard not to cut the price. And of course, if some of them are really expensive, like having a network of artificial intelligence that is driven by data and that allows your architecture to absorb this data and put it in the AI system. Imagine that's like the future of wishful thinking for everyone, right? That's expensive. But if you make the accountant on that on a country, if it's a good system, I underline that. If you evaluate the impact on the cost, the total cost of care per patient in 3 to 4.5 years, it's already paid and it's already giving profit only in money wise. If we think about healthcare wise quality, like DALIs, QALIs, and so on, it's already in the first 5 months. So my advice would always be to put the people that know about it in the discussion and then take the decision after, of course, but make them discuss. because sometimes we just listen to the experts from the enterprise that is trying to sell us something. We have to put the experts from our side too. So not being very, I'm being really white or black on that, because I think there are no gray answer.
Thank you.
Thank you, Josef. Thank you, Sophia, as well. I would also like to put in the discussion some potential question or perspective from colleagues from EIT Health. So Tamás or Beata, if you are with us, do you have any questions for the speakers, or what is your potential perspective on the patient privacy across Europe?
Good morning, everybody. I'd like to read the questions and opinions to Tamás.
Sorry, Beata, to interrupt, but I can hear you quite bad.
Yes, yes, sorry, I hope you can hear me better. So thank you for the opportunity. I'd like to read the opinion to our experts. Congratulations on this study.
Sorry, I still hear you quite bad. Could you potentially maybe write that in the chat in the same time, and I will return to that question in a while. Tamás, are you with us here on the call?
Absolutely, I'm listening.
Yes, hello.
This fantastic conversation.
Do you have
but I don't have any question.
You don't have any question. Okay, sorry. I know there is one point that you wanted to bring on today regarding the healthcare technology assessment, right? Could we potentially look at that in the meantime before we put on the question from Beata? Should I share the screen now, or you have it reviewed that you can put it there?
I don't think that we have enough time to discuss it. I just briefly want to mention it. So basically, first of all, congratulations to Czechs for the fantastic goal, and good luck for today at the European Championship. It was fantastic. And I got the so I'm a medical doctor with kind of experience. I mean, professional experience with US, German, Hungarian, and Austrian health system. So I worked as a medical doctor in that systems, and then switched to startup as an investor and founder as well. So basically, I'm a kind of the end user of this discussion, and I got the feeling like a child that the parents are talking about him, but not really involving in that. So I learned a lot about the child, about the parents thinking about me doing my job. But at the end of the day, I think I like Sophia's approach in terms of agile methodology. And the second thing that he started to talk about the differential benefit that any kind of innovation is creating. And I think there is a methodology out there, the early health technology analysis, which has a systematic way to figure out and quantify your differential benefit in terms of being cheaper, better, and faster. And based on that, you will be able to find the real value in terms of price of your application. And then based on that, you will be able to create any kind of net present value model and present to the people. And in my experience, 99% of the startups and innovation do not have this because they are not really qualifying any differential benefit, just pitching. And myself, in my experience, I reviewed my ideas, and most of the ideas failed. Whenever I done the early health technology analysis. So my message is very short. Get familiar with the early health technology analysis and do it.
Thank you, Tamás. This was a topic we actually covered during the past for Digital Health Acceleration Program with the startups last year as a way how to access very early in the stage a potential effectiveness and impact of the health technology solution. So thanks very much, Tamás, for that. Sorry for not having time to go into the details now. I think that being agile and co-create is very important even for this event. So I'm so happy that we were able to co-create this event together with Joseph as well in EIT Health. We had to be a little bit agile with the agenda, which moved a little bit from the original time, but I hope you will not kill me if I will say this is going to be the last 10 minutes of this call. I know that Joanna has to go, so thanks very much for the participation, for your presentation, Joanna. We appreciate, and this is going to be the last 10 minutes for those of you who can still stay. There is a time for 3 more questions. The first one will go to Hanna Chlebna from Czech West, asking whether you would like to shortly say what are the current potential challenges and opportunities from the side of Czech West, and we will have 2 more questions. And at the very end, I have a short interactive quiz for you guys. So, Mrs. Chlebna, could you please share, and thanks very much, Tamás, for participation as well. Could you please share your other questions or the current opportunities that lie from the side of the Czech West as well?
Oops, I have to unmute. Sorry for that. Thanks for inviting us. My role during discussion was meant to be to inform the businesses in the Czech Republic or researchers about the availability of financial resources that Czech Invest is implementing. I think that the operational program that will be open shortly under the Ministry of Industry and Trade offers quite a lot of opportunities in terms of the innovation of products and services, including the services for pharma industry. Digitalisation is a big issue in the Czech Republic, so the businesses will have an opportunity to apply for money under this headline. But what is more important, and what the pandemic proved, there is a lot of potential within the academic community. And we are very happy. We received a special funding for spin-offs and startups, and for the next 7 years, we will support them in development of their product and sharing the experience internationally. I'm really, really pleased that we will start actually in 2 weeks by opening the first hub. And as you can see, among other target areas is not only health tech, but also AI and digital. And the money will be available for not only businesses and startups, but also for those who have good ideas that we will evaluate, and we will help them to develop them into real products. So Czech Invest is more or less the agency that facilitates financially the communication between users and those that have some sort of offer for them. Very happy for that. Thanks.
Thank you very much for this introduction and input into the current opportunities and what you are planning. Time for 2 more questions before the final interaction. Sophia.
That was a raised hand, not digital. Sorry.
No problem.
I had a question actually for Hannah.
We have to be digital, right? You said.
Yes, digital. See, like a mix. Actually, I think it's for both elements from the ministry, because I think it's quite hard being on your side to select projects or to select priorities. So my question is, at this moment, going out of a COVID situation and with all the opportunities / doubts that we have regarding technology, how do you take decisions? I mean, how do you prioritize? Because it's really something that normally doctors in the fields, nurses, even the patients ask us, who took the decision? So how do you prioritize? How do you select priorities and projects?
We will have first of all, we have the general sort of checklist of characteristics of the patent or whatever it is. But we will also have the panel. Actually, the technology incubation will be run through hubs, and there will be people from academia, but also from businesses that will have the chance to say yes or no. It will be
toho ekonomického a
the applicants, but you know, you have to, as you rightly said, you have to have both sides behind the table to say yes or no, because I think that there is no say single rule how to evaluate the potential for any product or service. It has to be some sort of consensus in evaluation. So therefore we plan to have 8 hubs. Each hub will actually have people from academia, people from business, people from the public sector. I guess the EIT Hub will have someone who will represent also the ministry, not only the Ministry of Industry, but also the Ministry of Healthcare. So we just started, but the plan for the future is such that the hubs will have collectively will have the right to say, this is what we need to have, go ahead.
Thank you very much for the feedback. Thank you.
And the last question goes to raising the hands, physical or digital. We take both. By the way, this is the first time I actually hear how did you call it exactly, Sophia?
Digital?
Digital, yeah. Usually hybrids. But this
yeah,
is a nice
physical
one.
and digital. Digital.
So a last potential point for a digital question as well. And in the meantime, as it might be coming, I would like to still show you again the thing that is happening next week, with which we are actually following up on today's event. I'll put it on screen for you guys as well. I would like to highlight that we are continuing on the discussions from today, next week, on an event that is going to continue with Tomáš Vavrečka from Philips Health Czech Republic and Teun Šute from Obikety Europe Incorporated. They are going to provide not the perspectives per country like we did today, but they are going to provide some case studies of digitalization processes and projects across European countries from their own perspective and experience. And then all the conversation from today and all the conversation from Tomáš and Teun will be followed up then by a final aggregated moderated discussion on how to innovate the healthcare ecosystem in the Czech Republic. So I warmly welcome you to join us on the event next Wednesday from 10 o'clock again. I will send you an email today about that with recording of today's as well. I'll be very happy if you can join us. The conversation will be led and moderated by Adi Gaskell, who is an innovation writer and consultant in the UK, also writing about innovation in healthcare for Forbes and so on. So I'm now going to check if there is any question still here before we turn to the final interaction quiz for you guys that I have prepared together with EIT Health, and there is none. So let's move there, because actually the EIT Health InnoStars, which is a part of the EIT Health network, and Emerging Europe are actually running currently a survey to help us understand the trends and desirable progress in the development of digital health across Europe's emerging regions. And we will be very happy if you can give us feedback on mapping these trends that will contribute to making a white paper. It will be published and shared with you at a later stage of this year as well. So I hope that you are already somehow familiar with some of the tools used for online questions like that. I will put it on the screen for you now here as well. Give me 10 seconds, please. And the tool that we are going to use for this survey is called menti.com. I hope that you were already familiar with this tool from before. If not, it's not really so much difficult. If you have your own computer right now with you or any mobile, I would kindly ask you to go to www.menti.com. And once you arrive there, you will be required to put there a code. So please use the code on the top of the screen, which starts with 67971160. And as you will be there, I'll initiate that survey. The questions that you will be able to share on the screen here as well. And I'll be very happy if you could provide us the feedback on it. So I hope that you are all coming there. Right now at the moment, we are needing to have some inputs from you guys from the experience from the Czech Republic. And the first question on this survey is actually which one best describes you. So this is about your profile. So can you please stay there? What is your current profile for profiling questions on the survey first? Not a difficult one to start with. I know that we had on this call healthcare practitioners, executives, public authorities, investors, part of large companies, and a couple of startups as well. So maybe what we are missing were some academic institutions today and some students. The second question is, how much, in your opinion, has the COVID-19 pandemic accelerated the pace of adoption of digital health in your country? So please slide the bar between very little to a lot. This is the second question. If you have any problems turning from one question to another, you will be able to pressing a button which says that the presenter has published another site on the top of the page. I hope that works. Let me do a quick recheck with you guys. Does anybody of you have any technical problems on running this online questionnaire? Joseph, is it working correctly for you, for example?
Yes, it is. I'm on mute.
Thanks. So let's go to question number 3. Have you observed any particular area where digital health development has been impressive? This is an open question. So please, if you have any idea in regards to this, we'll be more than happy to get your inputs, at least very shortly. And there are 4 more questions. So with the 7th one, we will close down for today. Turning into the next question, number 4. What kind of digital health solution have been implemented due to the COVID-19 pandemic in your country? A couple of different scenario solutions. We'll be more than happy if you can provide us your perspective experience on that from the Czech market based on your profile and, of course, your role in the ecosystem. Question number 5 out of 7. Which benefits do digital health solutions help achieve? Is it about the costs? Is it about the process inefficiencies and so on? We'll be more than happy to know your inputs on this question as well. And as I said, it's not just about getting your perspective on it, but we will be able to get the white paper that is going to be published by EIT Health Investors and Emerging Europe based on all this information gathered through different countries of Europe. Katharina, I'm just asking you now, as you are my colleague on the call, does it work technically for you, this online questionnaire?
Yes, all works well, Michal.
Great, thanks very much. All right, let's go to the question number 6. Which factors can contribute to a faster development of a digital health in your country? Sorry for a small font on this, but I hope that on your screen you will be able to see it bigger than that. And this is the pre-last question, I promise. We will hop to the last one, which was number 7. And the last question is number 7, and the question is, any kind of other comments you might consider important related to digital health in your country? If there is something additional, please let us know during this last question of the summary. Otherwise, I have to say big thank you to Josef, big thank you to Sofia, big thank you to Joanna, big thank you to my colleagues, EIT Health itself, and also Mr. Zeman from Ministry of Health, Anna Chlebna from Czech Invest, and Tamás Babel from EIT Health for being part of this morning health talk from EIT Health today, organized by DEX Innovation Center in a cooperation with Direct People. So thanks very much for your time. I hope you enjoyed it as much as I did. I will have to listen to all the conversations again, and I'm very looking forward to see most of you on a continuation of this series next Wednesday at 10 o'clock with Tomáš, Teun, and Adi, and myself. Thank you very much and enjoy lunch. Sorry for a little bit delay, but it's Friday and you can continue working from home, which will not be so much of a big mess on Friday. Thanks very much and enjoy the rest of the afternoon.
Thank you.
Thank you. Goodbye. Have a nice
Thank you very
weekend.
much. Have a great day and have a great weekend. Bye-bye.
Thank you. Bye-bye.